Hi, Dr. Desmond Roy, a gastroenterologist and hepatologist. Today, a patient asked me about his liver cancer. I got this patient, they have hepatitis B and liver cancer. After surgery, obviously, he is very worried about cancer coming back. So I explained the following things to him. Number one, liver cancer, the best treatment is still resection. Remove the cancer, throw it away to the lab. That's the best treatment. If the liver function is good, we do a resection. If the rest of the liver is not sufficient, we do a liver transplant. For him, the liver function is good. We remove the tumor, and that's it. He's doing well from the surgery. And he asked me about recurrence. There's basically two types of recurrence. One is what we call the early recurrence. Second is what we call the late recurrence. What is early recurrence? When we see a liver cancer in the liver, we are worried that the cancer has spread. So we'll do a chest X-ray. If in doubt, we do a CT scan or a PET CT scan. If we see that the cancer has spread, we normally would not recommend doing surgery, because if the cancer is spread outside the liver, removing the liver cancer from the liver, it won't help very much. And if we see that spread to one location, very often it has already spread to many locations. So if we find that they have spread outside, we will not proceed. And obviously the liver is very big, the left and the right lobe. If they have cancer all over the liver, surgery is not suitable. So we usually operate when there's no spread outside the liver and the cancer are focused on one part of the liver that we can safely remove, with the left rest of the liver sufficient to support the function. So after we take out the cancer, we are worried about a few things. Number one, we are worried that the cancer has already spread. They're just too small to be detected. PET scan had a limit of how big the tumor is. It cannot pick up a small spread. So if there's a small spread, the PET scan didn't show it, and after the surgery, they will show up. Now, I repeat, if the PET scan pick up a spread, we will not proceed to surgery. When the PET scan did not pick up a spread, or the PET scan say no spread, doesn't necessarily mean no cancer spread, because they can be too small to be detected. Patient must understand this principle before they go for surgery. So I told the patient there's no spread before the surgery. We are still worried that something small has spread, but they will slowly come out. This tumor normally come out within the first 2 to 6 months. We will see that coming out in the lung, in the bone, or on the rest of the liver. So we call it early recurrence. How do we treat early recurrence? Well, if it is for breast and colon cancer, we suspect they may have early recurrence risk. We give them what we call adjuvant therapy. We give them chemotherapy to delay the cancer from coming back. But for liver cancer, adjuvant therapy is not proven, because we can't be sure that by giving them a chemotherapy after the cancer surgery, we can make them live longer. It is still being studied. There are many studies going on, so just wait. But as of now, if we don't have anything to offer. But what can we offer is a close monitoring. I will normally see them 1 or 2 months later with a scan and the alpha fetoprotein. Another 2 months later, for the first 1 to 2 years, we'll watch them like a hawk, watch them very closely for early recurrence. If they have, what are the factors that can predict early recurrence? Obviously, if the cancer is very aggressive, then we worry that they have already spread before the surgery. So after the surgery, they come out. What are the factors that are associated with a aggressive tumor? A big tumor, more than 5-6 centimeter, multiple location, we call it multi-centric, and it is a high-grade cancer. The cancer look very aggressive kind of cells under the microscope, and they have invaded either the lymph node or the blood vessel or the nerve inside the liver, or when they have a very high cancer marker, the alpha fetoprotein. So these are the factors that we are worried that they would have the very aggressive tumor. They could have spread even before the surgery. The second recurrence that we worry about is called the late recurrence. We explained it like that. The liver is like that. For this patient, I told him, you have hepatitis B, and that's why you got liver cancer in one part of the liver. We remove this cancer, that's great. But for the rest of the liver, they are still affected by hepatitis B. In fact, even if the viruses in the blood are undetectable, we can still find the viruses inside the liver cells, in the white blood cells. So they still have hepatitis B inside the liver. So the rest of the liver can form new cancer. But this risk is not very high. So even if they clear 2 years after the initial early recurrence phase, we still have to watch them closely. Every 4 to 6 months time, we do a scan, we do an alpha fetoprotein, and then we try to pick up any early cancer. any recurrence. If they have a recurrence, what do? We go to the same algorithm. We consider surgery, transplant, chemo, targeted therapy, local regional therapy, etc. Depending on how big the tumor, how many locations of the tumor, where the tumor, and how good the liver reserve is. So this is how we treated liver cancer. As a patient, what can you do? Number one, follow instruction. We ask you to come back. Please do see the doctor regularly. For the first 2 years, it may be more frequent, maybe 2 to 4 months, go back for a scan and alpha fetoprotein test. And even after 2 years, we ask them to come back minimum 6 months to do the check. Do go back to see the doctor if you are the patient. Number two, there are things that will increase the risk of liver cancer in everybody, and these patients that have liver cancer before, they should be very careful. Number one, if you smoke, don't smoke, and don't pick up smoking. Smoking increases the risk of not just lung problem, heart problem, but also liver cancer. So if you smoke, don't smoke, and don't pick up new smoking. Number two, if you drink alcohol, stop drinking. We actually want them to drink zero alcohol after liver cancer surgery, just in case they cannot control themselves when they drink too much. Number three, fat people have more cancer than thin people. So if they're overweight, consider losing the weight back to a BMI for Asian less than 23, for Caucasian less than 25, and come back for regular follow-up. These are the things that we suggest to patients. To sum up, when a patient has liver cancer, we do a successful liver surgery. That is just the beginning of a long journey. We work with them as hepatologists. We take up the liver, we take up the cancer, we work with them, we watch out for new recurrence. We advise them to drop the risk of recurrence, and hopefully they live as long as possible. This is Dr. Desmond. Any question or comment, leave it there and I will try to answer and make a new video on your question. Thank you.